I was around 12 years old in a doctor's office waiting for the results to be brought back. I had been waking up in the middle of the night needing the bathroom every night for some time now, and my mother assumed I had a urinary tract infection. When the doctor returned, he gave me the news that changed the rest of my life. Today, I'm going to be educating you on the differences between type 1 and type 2 diabetes. If you know what diabetes is, this will be a recounting of my personal story and experience. If you don't know what diabetes is, then I hope to explain how diabetes is extremely prevalent and why knowing the differences between the two types is important. I am able to speak on this because I am a type 1 diabetic and my grandfather is a type 2 diabetic. I've also included information from government health websites such as the CDC. First, we'll go over what diabetes is. Second, we'll go over what causes diabetes, and finally, how to manage it. All right, let's get started. Diabetes can be described as a disease in which the sugar in your blood is imbalanced due to an ineffective pancreas. There are a few different types of diabetes, with two of them being the most prominent. Type 1 diabetes is an autoimmune disorder where your pancreas doesn't work at all. According to Diabetes UK's differences between type 1 and type 2 diabetes, type 1 diabetes is an autoimmune condition because the insulin producing cells have been attacked and destroyed by your immune system. This is mostly found in younger people, but can be found later in life. Type 2 diabetes is a little bit different. The pancreas works, but the body has built a resistance to the insulin. This is mainly found in people middle age of older. Some of the symptoms for diabetes include excessive urination, excessive weight loss, mood swings, and blurry vision. Now that we know what diabetes is and how to recognize it, let's talk about what causes it. Type 1 diabetes doesn't really have many causes or risk factors. It's mainly up to your genetics whether you get it or not. But type 2 does have a few. Type 2 diabetes can also be caused by family history, but you can also get it via excessive weight, lack of physical activity, advanced age, and unhealthy eating. The CDC recommends regular physical activity, eating a healthy diet, and keeping your weight under control in order to reduce your risk of type 2 diabetes. Now that we know what causes diabetes, let's talk about how to manage it. With diabetes, you have to control your blood sugar. And the best way to do that is to know what your blood sugar is. There are generally two ways to test your blood sugar. One is with blood glucose monitors, and one is with continuous glucose monitors. Blood glucose monitors require you to draw blood from your finger in order to test it in the device and in order to get your blood sugar. But continuous glucose monitors allow you to implant it under the skin in order to continuously watch the blood sugar and keep track of it. Continuous glucose monitors, or CGMs, are generally a little less accurate than blood glucose monitors, but they're very effective. The CDC lists that the ideal blood sugar target is between 80 milligrams and 130 milligrams. The next way to manage your blood sugar is using medication. Insulin is the predominantly used medication for diabetes. There's two different types of insulin that are used: long-acting and short-acting. Long-acting is given once per 12 hours and can keep your blood sugar regulated, whereas short-acting is usually given at meals for the carbohydrates that you eat. These can be given via syringes, but they can also be given via insulin pumps, which are devices that feed a tube into you and give insulin throughout the day instead of once per shot. Another method of controlling your diabetes is through hemoglobin A1C tests. These are generally done at hospitals, but can be done at home if you have a kit. A1C tests are used to test the average blood sugar level for 3 months via the glucose that attaches itself to your hemoglobin in your blood. The final method of managing your diabetes is diet control. With diabetes, instead of calories, you have to count your carbohydrates, as these are basically what break down into sugars. In conclusion, we've now seen what diabetes is, what causes it, and how to manage it. My doctor came back to me with a result that showed my blood sugar was nearly 500 milligrams. What followed was 2 weeks in a hospital learning how to manage my diabetes and keep my blood sugar under control, with the help of wonderful nurses and doctors to teach me. There are 38.4 million Americans with diabetes, and I think it's important to understand it as a disease so that we can help deal with it and help others who deal with it. Thank you.